Have you ever wondered if the pills you take every day could be silently stealing your memories? It's a terrifying thought, but the truth is, some of the most common medications in your cabinet might be increasing your dementia risk. In this video, we're diving deep into 4 everyday drugs linked to memory loss that could be putting your brain health in danger. From surprising side effects to practical steps you can take to protect yourself, we're uncovering it all. You need to watch this until the end because knowing these risks could be the key to safeguarding your mind and ensuring a vibrant, healthy future. Don't miss out on this life-changing information. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Number 1. Anticholinergic medications. Among the medications associated with an elevated risk of dementia in older adults, anticholinergic drugs are among the most prevalent and concerning. These medications are commonly prescribed to address a wide range of conditions, including allergies, overactive bladder, insomnia, depression, and gastrointestinal disorders such as irritable bowel syndrome. On the surface, they appear benign, offering relief from bothersome symptoms like sneezing, frequent urination, or difficulty sleeping. However, their mechanism of action, blocking the neurotransmitter acetylcholine, which is critical for memory, learning, attention, and overall cognitive function, raises significant concerns, particularly for older adults. Acetylcholine is a cornerstone of healthy brain function, facilitating communication between neurons and supporting processes like memory consolidation and problem solving. When anticholinergic medications suppress this neurotransmitter, even temporarily, they can trigger side effects such as confusion, forgetfulness, difficulty concentrating, and, in some cases, delirium. For younger individuals, these effects may be mild and reversible. However, for older adults, particularly those over 65, whose brains are more vulnerable due to age-related changes or pre-existing cognitive risks, the consequences can be far more severe. Research has consistently shown that long-term use of anticholinergic medications is associated with accelerated cognitive decline and a significantly increased risk of developing dementia, including Alzheimer's disease. What makes this issue particularly alarming is the widespread use of these drugs, often without patients or even their healthcare providers fully recognizing their cumulative impact. Anticholinergics are not limited to prescription medications. They are also found in many over-the-counter remedies, such as antihistamines for allergies, e.g., diphenhydramine, commonly known as Benadryl, sleep aids, and cold medications. Older adults may inadvertently take multiple anticholinergic drugs, prescribed or over-the-counter, resulting in a phenomenon known as anticholinergic burden. This cumulative effect can amplify cognitive risks, as the drug's effects stack, often without clear warning signs until significant impairment occurs. Consider the case of Eleanor, a 74-year-old retiree from Ohio. For years, Eleanor managed her chronic seasonal allergies with an over-the-counter antihistamine and took a prescribed medication for an overactive bladder, both of which had anticholinergic properties. Initially, these medications provided welcome relief, allowing her to enjoy daily activities without constant discomfort. However, over time, Eleanor began noticing troubling changes. She struggled to recall names, misplaced items frequently, and felt mentally foggy, which she attributed to normal aging. Concerned, she consulted a pharmacist during a routine medication review. The pharmacist identified the anticholinergic effects of her medications as a potential contributor to her cognitive symptoms. Working with her doctor, Eleanor transitioned to alternative treatments with fewer cognitive risks, such as a non-anticholinergic antihistamine and bladder training techniques. Within months, she reported improved mental clarity, sharper focus, and a renewed sense of alertness, underscoring the profound impact that medication adjustments can have. The ubiquity of anticholinergic drugs compounds the challenge. Many patients are unaware that medications they've taken for years, sometimes decades, carry these risks. Over-the-counter products, in particular, are often perceived as harmless because they don't require a prescription. Yet, for older adults, whose bodies metabolize drugs more slowly and whose brains are less resilient, even small doses can accumulate over time, subtly eroding cognitive function. Studies, such as those published in journals like JAMA Internal Medicine, have highlighted how prolonged exposure to strong anticholinergics increases dementia risk by as much as 50% in some populations. This is especially concerning for seniors who may already be managing multiple chronic conditions and taking several medications. To mitigate these risks, proactive steps are essential. Older adults should regularly review their medication lists with a healthcare provider, ideally a geriatrician or pharmacist familiar with anticholinergic effects. Key questions to ask include, do any of my medications have anticholinergic properties? Are there safer alternatives for my condition? And can non-drug approaches, like lifestyle changes or physical therapy, help manage my symptoms? In many cases, alternatives exist, such as non-anticholinergic antihistamines, bladder training, or dietary adjustments for gastrointestinal issues that can provide relief without compromising cognitive health. The goal is not to forego necessary treatments but to make informed, brain-protective choices. For some, this might mean switching to a medication with a lower anticholinergic burden, reducing dosages, or exploring non-pharmacological options like cognitive behavioral therapy or physical therapy. Staying vigilant about medication side effects empowers older adults to maintain their cognitive vitality while still addressing health concerns. By understanding the risks of anticholinergic medications and advocating for safer alternatives, seniors can take a critical step toward preserving their mental sharpness and quality of life for years to come. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 2. Sleep aids and sedatives. Another class of medications frequently flagged by neurologists for their potential to increase dementia risk in older adults is sleep aids and sedatives, particularly benzodiazepines, e.g., lorazepam, diazepam, and non-benzodiazepine hypnotics, e.g., zolpidem, commonly known as Ambien. These drugs are often prescribed to manage insomnia, anxiety, or agitation, conditions that become increasingly prevalent with age. While they can offer significant short-term relief, helping individuals fall asleep or feel calmer, their prolonged use carries substantial risks to cognitive health, making them a critical concern for seniors and their families. Sleep aids and sedatives work by depressing the central nervous system, slowing brain activity to induce relaxation or sleep. While this can be beneficial in the short term, particularly for those struggling with severe insomnia or anxiety, it disrupts the brain's natural rhythms. The brain relies on balanced cycles of activity and rest to support memory consolidation, emotional regulation, and cognitive processing. Over time, the suppression of normal brain activity caused by these medications can lead to side effects such as confusion, memory impairment, and difficulty with focus. Research, including studies published in the BMJ and other peer-reviewed journals, has linked long-term use of benzodiazepines and similar drugs to a significantly higher risk of cognitive decline and dementia, with some estimates suggesting a 50 to 80% increased risk of Alzheimer's disease with prolonged use. The case of Henry, a 78-year-old retired accountant from New York, illustrates the potential consequences. Henry had battled insomnia for years, particularly after his wife passed away. His primary care physician prescribed a benzodiazepine to help him sleep, and initially, it was a game-changer, allowing him to rest through the night. However, after several months, Henry's family noticed troubling changes. He struggled to remember recent conversations, seemed disoriented during the day, and had difficulty focusing on tasks like managing his finances. Alarmed, his daughter accompanied him to a follow-up appointment, where his doctor reviewed his medication history. Recognizing the potential cognitive risks of long-term benzodiazepine use, the doctor recommended a gradual tapering of the drug, coupled with non-pharmacological interventions like cognitive behavioral therapy for insomnia, CBTI, and improved sleep hygiene practices, such as maintaining a consistent sleep schedule and limiting caffeine. Over time, Henry's mental clarity improved, and he reported feeling more engaged and alert during the day, highlighting the benefits of addressing these risks proactively. The widespread use of sleep aids and sedatives among older adults exacerbates the issue. Insomnia and anxiety can profoundly affect quality of life, prompting doctors to prescribe these medications as a quick and effective solution. However, the long-term risks are often under-discussed, and many seniors continue these drugs for months or years without reassessment. Additionally, older adults metabolize these medications more slowly due to age-related changes in liver and kidney function, causing the drugs to linger in their systems. This increases the likelihood of side effects, including not only cognitive impairment but also physical risks like dizziness, falls, and fractures, which can further compromise independence and overall health. The interplay between cognitive and physical risks creates a vicious cycle. For example, A senior taking a sedative may experience daytime drowsiness, increasing the risk of falls, which can lead to injuries that limit mobility and social engagement. Factors that themselves contribute to cognitive decline. Moreover, dependence on sleep aids can develop over time, making it harder to discontinue them without professional guidance. Alternatives, such as CBTI, mindfulness practices, or environmental adjustments, e.g., reducing screen time, optimizing bedroom conditions, or establishing a calming bedtime routine, can often address sleep issues effectively without the risks associated with medications. To protect brain health, older adults and their caregivers should initiate candid discussions with healthcare providers about the risks of sleep aids and sedatives. Key questions include: how long should I take this medication? What are the cognitive risks of continued use? And are there non-drug strategies that could help with my sleep or anxiety? Tapering off these medications, when appropriate, should always be done under medical supervision to avoid withdrawal symptoms. In many cases, small lifestyle changes, such as avoiding heavy meals late at night, practicing relaxation techniques like deep breathing, or engaging in light physical activity, can significantly improve sleep quality without relying on medications. The core message is clear: while sleep aids and sedatives can provide temporary relief, their prolonged use in older adults may come with hidden dangers that outweigh the benefits. By prioritizing long-term cognitive health and exploring safer alternatives, seniors can achieve restful sleep and emotional calm while preserving their mental sharpness. Making informed choices about these medications is a powerful step toward maintaining not only restful nights but also vibrant, engaged days filled with clear thinking and cherished memories. If you're finding this information valuable, please comment number 2 below to let me know you're engaged. For more insights like these, consider subscribing and enabling notifications so you don't miss future updates. Your support helps us continue delivering content to inform and empower you. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 3. Certain antidepressants. When considering medications that influence brain function, antidepressants are often among the first to come to mind, and their significance in mental health treatment cannot be overstated. These medications are critical for millions of individuals worldwide, helping to alleviate symptoms of depression, anxiety, obsessive-compulsive disorder, and other mental health conditions. For seniors, however, the choice of antidepressant requires careful consideration, as some, particularly older generation tricyclic antidepressants, TCAs, like amitriptyline, nortriptyline, or imipramine, have been associated with an increased risk of cognitive decline and dementia when used over extended periods. Tricyclic antidepressants work by modulating neurotransmitters, the brain's chemical messengers, such as serotonin, norepinephrine, and dopamine. These chemicals play a pivotal role in regulating mood, sleep, and cognitive processes. While TCAs can be highly effective in stabilizing mood and improving emotional well-being, their mechanism of action can also disrupt cognitive function, particularly in older adults whose brains are more vulnerable to chemical imbalances. Side effects such as memory lapses, difficulty concentrating, confusion, and slowed reaction times are not uncommon, and these symptoms can be mistaken for natural aging or even early dementia. In some cases, the medications themselves may exacerbate or accelerate cognitive decline, creating a complex challenge for patients and healthcare providers. Consider the case of Linda, a 69-year-old retired nurse from Colorado Springs. After losing her husband of 45 years, Linda struggled with profound grief and was diagnosed with major depressive disorder. Her primary care physician prescribed a tricyclic antidepressant, a medication she had taken briefly in her younger years without issue. Initially, the medication helped lift her mood, but over the next 3 years, Linda began noticing troubling changes. She forgot appointments, struggled to recall familiar names, and found it increasingly difficult to follow conversations. Her family, concerned about possible dementia, urged her to seek a second opinion. A neurologist, working in tandem with a psychiatrist, reviewed Linda's medication history and identified the tricyclic antidepressant as a potential contributor to her cognitive difficulties. Under careful medical supervision, Linda transitioned to a selective serotonin reuptake inhibitor, SSRI, a newer class of antidepressants with a lower risk of cognitive side effects. Over the following months, her mental clarity improved significantly, and she regained much of her confidence in daily activities. This scenario underscores a critical issue. Many seniors are prescribed older antidepressants like TCAs because they are well established, widely available, and often less expensive than newer alternatives like SSRIs or serotonin norepinephrine reuptake inhibitors, SNRIs. However, the potential risks to cognitive health cannot be ignored, particularly for individuals with other dementia risk factors, such as a family history of Alzheimer's disease, cardiovascular issues, or a history of head trauma. Research, including studies published in journals like The Lancet and JAMA Neurology, has highlighted a correlation between long-term use of certain antidepressants with strong anticholinergic properties, such as TCAs, and an elevated risk of dementia. Anticholinergic drugs block the action of acetylcholine, a neurotransmitter essential for memory and learning, which may explain their impact on cognitive function. The interplay between mental health and cognitive health is delicate, especially for seniors. Depression itself is a known risk factor for cognitive decline, and untreated mental health conditions can exacerbate memory problems or mimic dementia symptoms. Thus, the goal is not to avoid antidepressants altogether but to select options that balance emotional well-being with cognitive preservation. For example, SSRIs like sertraline or escitalopram are often preferred for older adults due to their more favorable side effect profiles. Non-pharmacological interventions, such as cognitive behavioral therapy, CBT, mindfulness practices, or support groups, can also complement or, in some cases, reduce the need for medication. It's critical to emphasize that any changes to antidepressant regimens, whether adjusting doses, switching medications, or discontinuing use, must be done under close medical supervision. Abruptly stopping antidepressants can lead to withdrawal symptoms, worsening depression, or other serious complications. Seniors and their caregivers should engage in open, ongoing discussions with healthcare providers to weigh the benefits and risks of their medications. Questions to ask include: are there alternative antidepressants with fewer cognitive side effects? Could non-drug therapies be incorporated into the treatment plan? Are there lifestyle changes, such as exercise or dietary improvements, that could support mental health? Staying informed empowers individuals to advocate for their health or the health of loved ones. The relationship between antidepressants and dementia risk is complex and not fully understood, but emerging research continues to shed light on the topic. By understanding the potential cognitive impacts of medications like tricyclics, seniors can make informed decisions that protect both their emotional well-being and their cognitive vitality. Aging gracefully involves nurturing both the mind and the heart, and with knowledge, careful planning, and collaboration with healthcare professionals, it's possible to achieve a harmonious balance that supports a vibrant, fulfilling life. Number 4. Over-the-counter PM pain relievers. For many seniors, over-the-counter OTC pain relievers with PM or nighttime formulas are a go-to solution for managing chronic pain and occasional sleeplessness. These medications, commonly found on drugstore shelves under brand names like Tylenol PM or Advil PM, often combine pain-relieving ingredients like acetaminophen or ibuprofen with sedating antihistamines, such as diphenhydramine or doxylamine succinate. While these drugs are marketed as safe and effective for short-term relief, their regular or long-term use can pose significant risks to cognitive health, particularly in older adults. Research has increasingly linked these sedating antihistamines to memory impairment, confusion, and an elevated risk of dementia, making their casual use a cause for concern. The sedating components in PM pain relievers work by suppressing activity in the central nervous system, producing drowsiness that helps users fall asleep. Diphenhydramine, a common ingredient, is a first-generation antihistamine with strong anticholinergic properties, meaning it inhibits acetylcholine, a neurotransmitter critical for memory, attention, and other cognitive functions. Over time, this suppression can lead to noticeable declines in mental sharpness, including difficulties with short-term memory, problem-solving, and orientation. For seniors, whose brains are already more susceptible to age-related changes, these effects can be particularly pronounced and may mimic or accelerate symptoms of cognitive decline. Take the example of Joe, a 75-year-old retired mechanic from Indianapolis. Joe had been dealing with arthritis in his knees for years and often struggled to sleep through the night due to discomfort. On the recommendation of a friend, he began taking an OTC PM pain reliever several nights a week. The medication provided relief, allowing him to sleep more soundly and manage his pain. However, over a year, Joe's family noticed troubling changes. He became increasingly forgetful, struggled to recall recent events, and occasionally became disoriented, even in familiar settings like his neighborhood grocery store. Concerned about Alzheimer's disease, His daughter accompanied him to a geriatrician, who conducted a thorough review of Joe's medications and lifestyle. The doctor identified the regular use of diphenhydramine-containing PM pain relievers as a likely contributor to Joe's cognitive symptoms. With guidance, Joe gradually tapered off the medication, replacing it with non-sedating pain relief options and non-pharmacological sleep aids, such as a consistent bedtime routine and relaxation techniques. Within months, his family noticed improvements in his memory and clarity, though some lingering effects underscored the importance of early intervention. The accessibility of OTC PM pain relievers makes them particularly insidious. Unlike prescription medications, which require a doctor's oversight, these drugs are readily available at pharmacies, grocery stores, and even online, leading many to assume they are inherently safe for frequent use. However, studies, such as those published in JAMA Internal Medicine, have shown that long-term use of anticholinergic medications, including OTC antihistamines, is associated with a higher risk of dementia. The aging brain is less efficient at clearing these compounds, allowing them to accumulate and exert prolonged effects on cognitive function. What's more, seniors may inadvertently combine multiple anticholinergic drugs, such as PM pain relievers, certain allergy medications, or even some prescription drugs, amplifying the risk. One of the greatest challenges is the lack of awareness about these risks. Many seniors and caregivers are unaware that the active ingredients in PM formulas can have such profound effects. Labels often emphasize the benefits, pain relief and better sleep, without clearly warning about the potential for cognitive side effects, especially with prolonged use. Pharmacists and healthcare providers can play a vital role in educating consumers, but it's equally important for individuals to take an active role in their health. Reading medication labels carefully, checking for ingredients like diphenhydramine or doxylamine, and consulting with a pharmacist or doctor before regular use can help mitigate risks. For seniors relying on PM pain relievers, safer alternatives exist. Non-sedating pain relievers, such as regular acetaminophen or ibuprofen, taken under medical guidance, can address pain without affecting cognition. For sleep difficulties, non-pharmacological approaches, such as cognitive behavioral therapy for insomnia, CBTI, progressive muscle relaxation, or creating a sleep-friendly environment, can be highly effective. Physical therapy, gentle exercise like yoga or Tai Chi, and heat or cold therapy can also help manage chronic pain without relying on sedating medications. Caregivers and family members should be vigilant, monitoring for signs of cognitive changes and discussing medication use with healthcare providers. Protecting cognitive health as you age requires a proactive approach to all medications, not just prescriptions. Over-the-counter drugs, while convenient, can carry hidden risks that accumulate over time. By staying informed, asking questions, and exploring safer alternatives, seniors can safeguard their mental clarity and maintain a high quality of life. Knowledge is power, and taking control of what you put into your body is one of the most effective ways to support both your physical and cognitive well-being. If you found this information valuable, please consider liking, sharing, and subscribing to stay updated on more health-related insights. Your engagement helps us continue providing content that empowers and informs. If you're still here and appreciating these tips, drop number 4 in the comments to let me know you're engaged. And don't forget to subscribe and turn on notifications so you never miss an update. Together, we can keep learning and advocating for better health as we age. That's a wrap on our deep dive into the shocking truth about 4 common medications linked to memory loss and dementia risk. Now, we want to hear from you. What's one key thing you've learned from this video that's got you thinking about your health? Maybe it's a medication you'll discuss with your doctor or a new step you'll take to protect your brain. Drop it in the comments below and let's start a conversation. If you found this video eye-opening, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more life-changing health insights. Stay informed, stay healthy, and we'll see you in the next video.